more, we can speak to Pascal André, an emergency physician and infectious disease specialist at Saint-Afrique Hospital in the south of France. Pascal, thank you for speaking to Paris Direct. What do you make of what you've heard from whether it's local officials or the national government? What do you make of their statements and how they've reacted to the strain that hospitals are under?
We are already overcrowding, overwhelming numbers existing among patients and staff. Tension, heat, conflicts, burnout, disengagement. We are forced to respond in emergency due to a lack of foresight, prevention, and organization. The foundation of any organization is the individual. Each of us shares responsibility for what is happening now, and we have the capacity to act. This is the cornerstone of Hippocratic medicine. Understanding and thinking ownership, though that we can look after ourselves and others. COVID had laid bare our failings, and an authoritarian response focused on public health has replaced the inter-individual approach, one full of common sense and effective, which could have sufficed without infringing on our freedoms.
Pascal,
In each,
yeah, sorry to cut you off. Heat waves, I mean, if we're looking at the data in front of us, are no longer every few years. They're every few months, sometimes every few weeks. Where are the most pressing changes needed? Is it in the healthcare infrastructure, in the staffing models, or investment?
Each of them. We are very exhausted because we are not efficient, not enough in the different boards for working, and we need really a real cooperation between healthcare workers and politicals, because it's very important to be in accord all together to fight against this problem of heat waves. But heat wave is not only now with the climate, it's really in the social climate too, though we have really to work together, because we have been very successful a few years ago during COVID, and after nothing more, it's very difficult to work as healthcare worker. It may be good to have climated hospital now. It's not the case now, because in some rooms we have more than 38 degrees, though it's very difficult to work. But we need more than that. We need to have healthcare workers in our hospital, because it's very important to privilege the financement of the hospital, the education. As a few days ago in London, more than 1,000 workers, healthcare workers and different workers, asked for stop financement of the war. We need war against what's happened now, climate change, social change, and we don't want no more money for the army. We need to take care of us all together in our differences. And as doctor, it's very important to support this.
Pascal, thank you so much for your time. Dr. Pascal André, thank you.